you're someone listening to this and you hear those symptoms and a lot of those, sound like is it a good idea to like track those and talk with your regular, PCP or,
Yes.
Yeah, because I know like in doctor's visits, it's not always, you get an hour or you get a long time, right? So how would you be able to say, hey, here are all the things I have. It might be this. Do you wait for the doctor to ask you? Like, what should that look like?
Oh, that is such a good question, Megan. But until then, I think it is still so important for women to advocate for themselves. Like if you are not feeling like yourself, trust your body, know your symptoms, like talk by yourself. If your doctor's not listening, which might happen, unfortunately, find someone that you trust and is listening to you. Tracking symptoms and what like onsets triggers, I think can be really helpful. One big caveat is that although menopause and perimenopause can cause so many symptoms from head to toe, it isn't necessarily 100% the issue or cause. And it's also important because women are at risk of, so many unique health risks, whether it's bone health, osteoporosis, a higher risk of dementia and Alzheimer's, a higher risk of like cardiovascular disease and heart attacks, that if you're, 45 and having palpitations, it might be menopause related and very much influenced, but also still important to see your heart doctor and get that heart symptom evaluated. We don't really have good blood work or tests that say, yes, this symptom is 100% menopause. So essentially what we have to do is make sure that it's not something that is related to a primary medical condition. For instance, like thyroid disorder affects 1 in 10 women by the time they're 40s and 50s and mimic a lot of symptoms in perimenopause. Yeah. So make sure that that's not causing, because that is treatable in a different way before we're like, okay, it is actually in fact perimenopause. So I think the conversation and tracking of symptoms is really critical.